All right, hey everybody, this is Dr. Matt Glassman at Upper Cervical Chiropractic. One of the questions I get asked all the time is, what does an upper cervical adjustment look like? So today we're going to demonstrate that for you. Okay, so the first thing we do is we get a postural measurement. We're going to be looking at the body's balance. We have two bilateral weight scales. We're going to see where the weight is leaning towards, where the level of the hips are, where the level of the shoulders are, whether or not the neck is on vertical and which side the head is tilting to. And then we're going to go ahead and make the adjustment where we look to reverse the breakdown of the three-dimensional postural alignment of the body. Okay, so after we get the postural measurement, the patient, as you can see, is going to lie down very comfortably on their side. We have a special headpiece here that we work up and down depending on what we need to do with the adjustment. And then in just a moment, you're going to see the adjustment itself, how gentle, safe it is. There's no twisting, no popping, no cracking, but also how dynamic it is. So I hope you enjoyed it. I hope you have a better understanding about what we do here after you see the adjustment, and let us know if we can help you. All right, so hopefully that answered a lot of the questions that are out there about what the upper cervical adjustment looks like. As you can see, it's really, really gentle, but very dynamic. We're seeing lives change in the office here and people regaining their health. So if you're looking for help and you want to sit down and have a conversation, have a consultation in the office, there's never a fee to do that, okay, to sit down, discuss your needs, see if this is the right place, the right care for you. All you got to do is give the office a call, click the link below, or call 212-334-1933, and looking forward to serving you. Thanks.